I think we are live.
Check the page once. Live.
Yes, we are live now.
We are live, right?
You can start the recording, Urmi.
Yes.
I think we are live. Page once.
Hello, everyone. A very good evening and warm welcome to the case report series. As you're all aware of, Optometry Council of India, in association with the American Academy of Optometry India Chapter, presents the case report series. In this regard, we have the second case report presentation today by Ms. Janet Phillip, who will be presenting on cerebral visual impairment. Before we invite Ms. Phillip, I would like to invite Ms. Lakshmi Shinde, the CEO of Optometry Council of India, to speak a few words. Over to you, Lakshmi.
Thanks, Anita, and good evening, one and all who are watching live and who will be watching it later as well. I think this is a great collaboration, I would say, between the American Academy of Optometry India Chapter as well as, the Optometry Council of India. We, as optometrists in our younger days, always used to look up to AAO, the presentations in AAO, even now. So I think this way we can actually build a lot of young talent in terms of be it fellowship in the academy or be it such case reports which Janet is presenting and one person presented earlier as well, and maybe developing some kind of special interest groups and various research groups as well. So I just welcome this collaboration. And I hope it educates and kindles a lot of interest among young optometrists, in the field of optometry in terms of clinical knowledge, what they're learning, what they're seeing in terms of cases, and so on. So really nice, really happy to see this kick off in such a nice way. And Janet, I saw your topic and I said, oh my God, this is something that I'll never understand, nor will I know in clinical practice. But I think optometry that way, I mean, we're so proud as far as India is concerned, the way optometry has grown from what it was, maybe 20 years, 25 years ago, to see it now with all these young optometrists, so many of them even leading educational institutions now, and then, performing so well with postdoctorals and PhDs abroad as well as in India. So thank you, Anita, and thanks for putting this together as well, Anita.
Thanks, Lakshmi. To introduce the speaker for today's case presentation, I would like to invite Soumen Sadhu, an optometrist as well as a fellow of the American Academy of Optometry. Over to you, Soumen.
Thanks, ma'am. So good evening and warm welcome to the webinar by Optometry Council of India in association with the American Academy of Optometry India Chapter. So myself, Soumen Sadhu, I will be moderating today's session. So on behalf of American Academy of Optometry, I take the privilege to welcome you all here. And today we'll have an interesting topic to learn and discuss, that is on the diagnosis and rehabilitation of children with cerebral visual impairment. So we will take the questions at the end of the presentation. Kindly drop all of your questions in the chat box. So without any further delay, I welcome on board our speaker, and let me introduce you, Ms. Janet Phillip. So Janet completed her bachelor and master's in optometry from the prestigious Elite School of Optometry in 2020, and during her master's period, she has successfully completed the American Academy of Optometry Fellowship. She is currently doing her first year PhD in translational vision science at the Radboud University in collaboration with the Royal Dutch Vision in the Netherlands. She is an early stage researcher in the Optivist Network. She also serves as a content creator for the blog Stories from India for Cerebral Visual Impairment Scotland, a popular website for practitioners and parents with children suffering from cerebral visual impairment. Currently, in her PhD, she is working in the area of cerebral visual impairment diagnosis. Welcome, Janet, and the mic is all yours for the next 45 minutes to 1 hour. Over to you.
Thank you.
Salman for that introduction. And yes, everything he said about me is true. So I'm just going to, I think, open up my presentation. Salman, can you see my slides?
Yes, your slides are visible and you are audible enough. Yeah.
Okay. Thank you. I just want to say that I'm very glad to be a part of this amazing initiative by OCI and AAO India Chapter, especially as a new fellow. And I think this is a great opportunity for me and all of us as new presenters to learn, and also for all of you joining to learn about the process and also about different fields in optometry. So today I'm going to be talking to all of you about this particular case report, which I wrote and I submitted for the FAO. And this is about cerebral visual impairment. So CVI is something that I was very passionate about. I worked in CVI for my master's and also now for my PhD. So therefore, this case report. And I'm just going to be also talking about the case a little bit, and also going through my case report. I'm just going to open up my case report and also show you how I wrote this particular case. And I hope this presentation is useful to everyone who has joined today. So I'm sure that a lot of people, most of you at least here are who have joined here are looking forward to doing an FAO, I think. So I just want to, if you are in the process of doing an FAO, if you just have the slightest idea of doing it, I think I would say that you are on the right track. You should definitely try to do this, because I think for me, this was a benchmark in my because I did it earlier on in my career. I think this has been very helpful for me in my career and also in building my network. So don't think about it, just go for it. So just a quick snapshot of just what you have to do. First, you need to submit an application to the all of this is present in the website. So you need this particular checklist, and once you have this, you can submit your application. And after that, you will have a subcommittee chair contact you, and you can ask your questions to this particular person, and they will really help you throughout the process. And also, this is the person who will be evaluating your case report. So it's nice to have a good relationship with your subcommittee chair. And after that, you have to compile 50 points. You have a lot of options based on which category you apply to. So you can work on these 50 points along with your subcommittee chair, and then submit these 50 points. And based on these 50 points, you will obviously appear for an oral exam, which is again a very interesting experience for me. So talking about FAO, you can actually apply in like 3 categories. So you have a clinical category, where if you're a student like a bachelor or a master's student, or if you are a clinician, then you can probably opt for this. If you have a couple of publications, and if you're into research, then you can go for the scientific category. And if you're probably way ahead in your career, if you are an educator or if you have a private practice, then you can probably opt for a special category. But I did my FAO when I was in my master's. So I opted for the clinical category. And I basically submitted 1 case report. I submitted 2 poster presentations and 1 paper presentation, and 1 leadership contribution essay. So you can ask me, what did you write for leadership contribution essay as a student? Well, it was a very interesting experience. I wrote about my master's research. So you can probably just go for any of these options, but obviously you need to write at least 1 case report. So today I'm going to be talking about that 1 case report, which I submitted for my FAO clinical category. So just before moving on to the talking about the sections of my case report, I just want to give like a quick overview of what my case was all about so that we can understand, I think, just understand the case before we proceed. So this was actually a case of a 2-year-old female who came to the pediatric ophthalmology department of Shankar Nethralaya. And this child had visual concerns since birth. So she was diagnosed with cerebral visual impairment, and which was because of neonatal encephalopathy. And along with the other examinations, the most important thing that we did in this case was perform a functional vision assessment. So a functional vision assessment is something that is extremely important in a case with CVI. And this basically helps us understand how the child is able to use their vision in the day-to-day activities. And so this showed that she had difficulty with maintaining visual attention, alertness, fixation, tracking, and eye contact. And we also saw like reduced visual acuity and contrast sensitivity. And this was from a visual point of view. And from other point of view, she also had issues with fine motor, gross motor, and also sensory integration. That is just being able to integrate and use all the senses together. That was an issue for this particular child. So then once we diagnosed the problem, we sent the child to the in-house rehabilitation expert, who basically drew up an early intervention plan for this child. She underwent 34 sessions of in-office and as well as home-based early intervention, after which we were able to see improvements in the child. So in my particular case, there were a lot of specialists who were involved, because for CVI, as you can see, this child had multiple disabilities. And in such a case, taking a multidisciplinary approach is extremely important. And so we had an optometrist specializing in functional vision examination, a pediatric neurologist. We had a lot of rehabilitation specialists specializing in vision, specializing in motor. So a lot of people involved in just treating this particular patient. So I just wanted to ask all of you to take a minute to probably take a few seconds to think of what do you think about this particular case, or what do you think when I told you about the case, like, do you think it's complicated? Do you think that the case is it looks complex? Do you think the case looks it's difficult to understand, or do you think it's interesting? So just take a few seconds to just think about how do you, because I have a lot of things going on, I have a lot of people involved in the case, so you can just think for a few seconds what you really think about this particular case which I had chosen for my FAO. So with that thought, I want to just start by saying that the first step for writing your case report, I think, is selecting your case is extremely important. So you need to just ask yourself these 3 questions, like, is your case complex and interesting? Because I think from an FAO point of view, what they really expect is for you to have a complex and an interesting case. And the second thing is you need to ask yourself, does it motivate you? Because you can ask me, like, do you really need a case report to motivate you? I would say yes, because I think you need to be able to find a case that really motivates you. I think instead of just choosing some case, I think it's important to know where you have your interest on, and then picking a case from that. That's what happened in my case when I chose this particular case. And the last thing is you need to know, you need to ask yourself, does this case stand out? Is it unique? You need to ask yourself, does this case stand out and is it unique? Because it's extremely important to know that, someone is choosing a case and I want to choose the same case, or I want to do exactly something like that. Instead of that, I think you need to give yourself a challenge and say that I want to really pick something that is like a standout and that is extremely unique. Because what the reviewer is looking for is something that is unique and something that is complex and something that really is like extraordinary and stands out. So I think I would say that when you select a case, just ask yourself these three questions, and look for answers, and see what you think is the answer for these three questions. So I think that's number one. And number two is obviously writing your case. So you can ask me like, okay, you asked me to select a complex case, how do I write it? So I think what's very important with writing your case when it is complex is to, I think, just plan. So I had 34 sessions of therapy in my case, and I had to go through each of these to come up to actually write the case report. So for example, I created a visual summary of my timelines of visits, and which really helped me really analyze how the case is and write it. That made it very simple for me. So when you write your case, I think what's really important is to create a visual plan or a visual summary of your case, and then be as creative as possible when you write your case. So your case body, or rather your case details, is what the reviewer is looking for. And obviously anyone who is interested, for example, in my case, anyone who's interested in pediatric optometry is looking for. So I think it's nice to be more creative and think outside of the box when you write your case report and the way you present it. So that's something that I just wanted to say. And again, from an FAO point of view, you need to stick to the AAO case report guidelines. And so now I'm just going to be talking to you about my case in the next few slides. And I'm going to be talking from the point from the case report guidelines, which is mentioned in the website. And final thing is obviously to revise and like even more revisions, because I remember how my first draft, I think any expert over here who wrote a case report knows how the first, or any paper knows how the first draft is and how it looks after a couple of revisions. So I think it's really nice to revise your case as much as possible to get the best outcome of your case report. So with this, I think, yeah, so I just wanted to please go ahead and check this case report guidelines. It's just there on the website. And this is sort of like should be your Bible to writing your case reports from an FAO point of view. So these are the parts of your case report. So you start with a cover page, and then you talk about the abstract, and then keywords, introduction, and then your case body, your discussion, and then your conclusion. So I just want to ask the people who have joined today, if anyone is submitting or planning to submit a pediatric case report, because today I'm just going to be talking from a pediatric point of view. So I'm interested to know if anybody in the audience is, probably planning to submit or submitted a case report. You can just go ahead and say like, yes, or maybe you're just thinking about it. You can probably just type in the chat box if, like you're planning to write a case report that is related to, a pediatric audience. So let's see if we have some replies, or else we can proceed. Okay, so I think I'm just going to proceed, but you can probably just type in the chat box if you're thinking of submitting or planning to submit a case report, which is pediatric. So starting with, I think, the cover page, I think you have to probably write about your personal details, title, a brief abstract of about like 10 lines, and then just your keywords. So this is my cover page. So I think last month, Manasi sort of like explained a lot about how to write a case report. And I think also she said about how important a title is. So if you haven't checked that video, you can probably go back and check that video. So this is something that's really important, because the title of your case report is something that like really draws the attention of the reader and also the reviewer. So you can come up with something that's really innovative. For example, I went for this title, a multidisciplinary early intervention approach for CBI, the need of the hour. So when someone reads this, they know that, okay, this is really important and I have to read this case report. So something like that is, what your reviewer or is really expecting. And then, of course, all of us know how to write an abstract. So in my abstract, I spoke about a gist of my case report. Obviously, I cited what is the child, what's the issue with the child, and what assessment we did, and then about the therapy and how much the child improved and what she improved. And then, of course, your keywords. So I'm not going to go much into this. I think the next thing is obviously your introduction. So your introduction can be about like 1 to 2 paragraphs. So you can talk about the background information, the previous evidence, and the gaps in literature. So I just want to open up my case probably and just show. So I hope you can see this.
Yeah, we can see it, Janet. Continue.
Okay. Okay, so this is my introduction. I kept it to just 2 paragraphs. So in the first paragraph, you can talk about, I spoke about what, just on a very broader level, what is CBI. I talk about the definition, the causes, the clinical presentation of CBI. And then in the second paragraph, I spoke about what are the different diagnostic techniques used. And then immediately I dive into talking about my early intervention. So here you can see I've cited some of the articles which is used in for early intervention based articles. And then immediately I talk about my gaps in the current evidence, especially pertaining to this case report. The gap is that we have a lack of standardized evidence-based protocols for early intervention with CBI, and therefore I introduce the topic by saying that I come up with this case report, which will talk about the planning and execution of the early intervention, which is something that is very less in the literature. So this is about, so I basically start with on a very broader level, and then I narrow down my case report to my gaps, and then finish it off with my by introducing my topic. So that's just about the introduction. The next and the most important part over here is your case body. So, and I just want to talk from a pediatric case point of view, in case you are someone who is writing a pediatric case report. Obviously, what's very, very important is history. So the reviewer is obviously going to look for detailed history in a pediatric case and an elaborate birth history. So it's important that we specify the history, and specifically the birth history, especially in a case like CBI. I think the birth history is sort of like the first thing that comes to your mind. So that's really important. The next thing is observations. So both visual as well as external observations. In my case, for example, the child did not just have visual concerns, the child also had external issues in other parts of the body. So any pediatric patient, you can expect something like this. They can have both visual abnormalities, which can be combined with some sort of an external abnormality. So I think it's important to specify that. And also the assessments are really important, and they are different when compared to an adult, and the way the tests which are being done, the tests which are chosen in a pediatric case are very different from adults. So I think it's important that we specify the assessments, and also it makes sure that we justify what these assessments are used for, and also it has to be complete. And also, and along with these assessments, what's really important is including the images and reports that are relevant to the case, especially if for FAO. I think the reviewers were really keen about the images and also the reports which were along with these for the assessments. So I think it's important that we specify that. And another thing in a pediatric case, I think, is a proper follow-up. I think if you're thinking of choosing a pediatric case, I think it's important that you choose something that is recent, because in a pediatric patient, the visual system is constantly developing, it's constantly changing. So selecting a case that was like a month before, a few years before, I think doesn't make sense. So I think it's important that your case should be as recent as possible. Even if it is not recent, you can do something about it, and you can probably add something which will increase the value of your case. So I think the follow-up, from a follow-up point of view, I think it's really important. And the next one is the specialists who are involved in the case. So in my case, as I said, there are so many people involved, so many specialists involved, and which can be also the case in your particular choice. So in such a circumstance, I think it's important that you justify everyone, all the specialists involved. And it is also really important to mention what was the findings and the outcomes in each of these visits or each of these referrals. So along with this, just a very important thing that is to work on your visual presentations. So I think it's very important, and it will enhance the quality of your case report, that you that we are able to work on proper visual presentations for the different categories or sections of your case. So you can obviously be as creative as possible and work on your visual representations. So I think when I show my case, I think it would be easier to understand this. So this is my case report. And so I first start off by talking about the patient. As I said, history is really, really important. So I say that my patient was, came in, and she had a history, a birth history, which was abnormal. So she had microcephaly, she had absence of body movements and cry, and she had a birth weight of 2.8 kilograms. I mentioned all of that. And also what's really important is, in my case, was MRI. I think people generally with CVI, I think MRI is something that you would expect to know. So I did not have the reports as such for the case, but still I mentioned the clinical findings, whatever was mentioned in the MRI. But I did go back and ask the patient if they had reports. Unfortunately, they did not have it, but still I tried to mention what was in the report as such. So this is all about the history of my patient. And then I go on to talk about the first visit, which was a comprehensive eye examination. And then the second visit, as I said, was a functional vision assessment. So over here, you can see that I sort of don't talk a lot about the comprehensive eye examination, because in my patient, for a CVI patient, I think focusing more on the functional vision assessment was more important than the comprehensive. So I just pick the things that are really important. For example, in CVI, you have to know if the how is the optic disc. So basically, I mentioned that it had a subtle pallor of the optic disc was present, and I talk about the CSM, and then immediately I just only pick the few details which are needed, and then I go to the functional vision assessment. So obviously, I think from this, it's important to just pace your decisions based on your case. And if it's a pediatric case, again, it's important to say like what is really needed in that particular case, and what test is important, and like what is required and what is not required. So let's just go through the functional vision assessment of my patient for a bit. So this patient had like a delayed visual alertness. Fixation was only to high contrast objects. She had a reduced visual attention, and we saw that she did not respond properly to like visual stimulus, but she was more receptive to auditory and tactile inputs. And again, her motion was like reduced. And then if you come to the second paragraph, I talk about visual acuity, which was again like reduced, and gross visual fields was like okay. and the contrast was again reduced. So this is something that we found in the functional vision assessment from a visual point of view. So in this particular 2 lines, as I said, it's important to have a look at both the external observations as well as the visual as well in a pediatric case. So here I say that the patient had like poor neck control, she had stiffness of arms, and like she had like drooling, and also this constant urge of like saying sounds. So all of these things were present, and she was not able to stand. She only stood with the support of her mother. So basically she had all of these other things which we did. So from this we understood like what was the problem of the patient, and then we planned for early intervention. So now the patient was referred to the rehabilitation department at Shankar Nethralaya for early intervention. So honestly speaking, when I took this case, I was kind of a little confused because I was not a rehabilitation person. I'm an optometrist. But then I very challengingly took this case, and okay, fine, I'm going to do it. But then this is not my area of expertise. So I was a little confused initially because I didn't know how I'm going to write this, because I didn't know anything about rehabilitation. But then I took this up as a challenge, and then I learned about the case. I made myself familiarized about the case and about what was given. And then the rehabilitation specialist and the team was very helpful when I wrote this case report. And then I tried to understand it. And then I went ahead and I wrote it, obviously. So I think if in case you are also in a position where you feel like, you're dealing with a case report which is challenging, which is probably not which is kind of beyond your competence, or it's in another discipline, I think it's just important to take time to get familiarized with that particular case and then like write it, because even if it is challenging, I think it's really worth it. So this is about the early intervention. I talk about the overall goals. I think the goal was just to help the child to learn, because in CVI, the child has his vision but not able to use it. That's the main issue. So we try to help the child to learn, and also kind of give this integrated therapy. We kind of concentrate on all of these different visual, motor, sensory, all of these different fields. So this particular section, I wrote it as 2. I wrote it as early intervention, like planning, and then execution. So how did we plan it and how did we execute the early intervention? So this is, again, I said 34 sessions. So here I just talk about like we had both in office where the patient came in, we did the therapy, and then home based where the mother was trained and the mother kind of did the therapy. And then so in this planning, what I did was I kind of brought in, like wrote it, did it like a flow chart. So instead of having to write it like monotonously in like sentences, I thought it would be interesting to just describe it in the form of a flow chart. So I just talk about how did we come up with this plan. We first understood the needs of the child. We prepared a customized plan, and then we set goals for each of these plans. We prepared for these activities, and then we trained the mother, and then we finally like went and did the intervention. So this was best way to represent the thing behind how we like plan the early intervention. So the next thing was program execution. How did we execute this early intervention? So if you're wondering what this part is all about, so this was just a little addition that we did to this particular case report just to accelerate the quality of the case report. So this was a particular rubric which I had used in my master's research. So we decided to kind of administer it to the parent of this particular child. I'm not going to go much detail about it, but this is just the idea behind using this particular assessment tool. So in the execution, obviously, we have in-office execution, activities, and home-based. So in in-office, I talk about what are the things that we did. And if you're handling a pediatric case, probably it's important to know your environment. So for example, in my case, I mentioned that my environment, that the in-office environment was clutter-free, noise-free, and child-friendly, because in a CVI or any case which involves a neurovisual problem, I think it's important to mention how your surrounding was. So that's why I have mentioned that. So in this table, I just give an overview of my skills, the activities, the different activities I've used, and then the goals for each of these activities. So this is like a quite long table where I just talk about each of these skills and what was the goal and the activity. So here are some pictures which I also added in my case report. So these are the early intervention tools which we actually used for the child. So if for a pediatric case, I think you have a lot of options with your images. So if you can be very creative with just adding some of the assessment tools or your rehabilitation tools or things like that to your case report, so that the reviewer connects to what you're trying to say in the case report. So this is just some of the tools which we used for the early intervention. And then this is the home-based rehabilitation thing where the mother was the one who did this. And here I talk about in this table, I just talk about the different skills which we trained, even for like the home based skills. And then like what are the different activities which we gave for the mother, and we trained the mother first of all, and then the different kinds of activities which we gave for the mother to do this at home as well. So the child had like simultaneous in-office sessions as well as like home. So both were like going like simultaneously. So this is again a couple of charts which we made for the child, and then we gave it, and then the mother was the one who used this to do the early intervention. So, and then finally, I just want to say that the child was not just from this point of view, but she also was referred to a neurodevelopmental therapist who outside of Shankar Nethralaya, and she also underwent rehabilitation over there. So there were basically a lot of like things going on, and so it was more like a multidisciplinary approach to early intervention. So the outcomes we saw after 34 sessions was really good. So here I talk about, in this table, I talk about the skills. I mean, the skills which, for example, in the visual developmental skills, what is the baseline that we saw? And after 34 sessions, what did we see in the child? What was the improvement? For example, the child turned her face to listen instead of looking at the objects, which is a very typical CVI feature or a CVI thing that you can see. So after 34 sessions, we saw the child sort of looked straight and to the object and responded. So I basically compiled all of these skills into one particular table, and then I just showed it like what is the baseline and then what happened after the 34 sessions. So this is about visual, and we also have sensory. For example, she did not feel touch, temperature, and texture. Initially, when she came in, she didn't do that. But then after the 34 sessions, she was able to feel touch. She was able to differentiate between temperatures and textures. And in fine motor, she was not able to reach, hold, and these any sized toys. But then after 34 sessions, she was able to reach and hold cylindrical objects, cylindrical toys. So these were some of the things that I mentioned in the outcomes. And finally, if you're wondering what this is, this was sort of like a addition that we did. So the patient was, this was during the COVID-19 pandemic that I wrote this case report. And so we caught hold of the patient, and then I made sure that me and the rehabilitation specialist, we followed up the patient, and then we made a call and we did an interview during the COVID-19 pandemic, just to include in the case report what is the most, how the patient is at recent. So that was the idea behind it. And it also was the idea behind it was to also enhance the quality of the case report overall. So we then called up the mother, and then we spoke to the mother, and we also asked a couple of questions, which is the PCA rubric, which I showed earlier. So we re-administered this particular rubric, and then we scored the patient, which was like baseline. This is the rubric, the questions in the rubric, the items in the rubric, and then we scored it like baseline, and then what is the after the 1 month follow-up, how much did it increase. So this was the idea behind it. And then I end by saying that my patient is on constant care and telephonic follow-up on a monthly basis. So I think this is also really important, that when you finish a case report, it's also nice to say what the patient is doing currently and what are your future plans for this particular patient. So, so I say that my patient, in the next phase, we are going to start the visual skills training shortly. So that's the idea, and the patient is now doing that at this moment. So it's nice, especially for a pediatric case, to say like what is the current status of the patient and how you're going to take this forward, how you're going to take the case forward. So this is basically about how I wrote my case, the case body. So now I think the next thing would be the discussion. So discussion, I'm not sure, but some of you may agree with me, the discussion is sort of like the hardest part. At least for me, it's the hardest part. Sometimes I shy away from writing a discussion, but I think it's nice because discussion can be very interesting at the same time to write. So I think the first thing is to make it authentic and as original as possible. And I think it's important to describe the diagnosis in a greater detail, talk about your decision making and why did you choose that. A discussion of a case report can be very different from a discussion of writing a paper. So from a case report point of view, especially from a pediatric case report point of view, I think it's important to discuss about the topic. I think also talk about the diagnosis and the tests which are used, the outcomes which we got, the treatment which was given. And I think to just sort of cross-examine all of these things and compare with the previous literature and say like from your original, from your voice, say like what do you think is going on with the patient or with the case. So I'm just going to quickly show you like my discussion. I think from what perspective I had written the discussion. So just in the first paragraph, I talk about early intervention, and I say that I talk about neuroplasticity, and I say that, neuroplasticity, considering the highly plastic cortex, I think during the critical period, doing an early intervention is really, really important for a child with CVI. And then in the following paragraphs, I go on to talk about the different therapies which was given. So I talk about the visual developmental therapy, and then I talk about the sensory integration therapy, and then I talk also, I think, about the neurodevelopmental therapy. And I say that, and I bring in some literatures, and I say that, in this particular paper, they saw that. And then in my case, we noted a significant improvement in all of these skills. And obviously, I say that could be due to the neuroplasticity, which is present in the earlier stages of life. And the highly plastic visual cortex in the earlier stages of life. So I basically talk about how important early intervention is. But then, like, I also say at end of every paragraph, what is the gap in this particular area? For example, in visual developmental therapy, what is the gap? In sensory integration, what is the gap? Because we have, I think, a lot of gaps still present in area of CVI, which needs to be explored. So I just end by saying that, this is all there, but still we need to understand this a bit more with a lot of more research. So I also then talk about the family, because I said the mother was a very, very important role in this case. She played a very important role. So I also say that in early intervention, generally in assessment or in rehabilitation, the family's role is really important. And that really helped my case. It created a positive emotional and physical environment. for the child, and that sort of elevated the process, because in the PCA rubric score we saw that the mother's score sort of increased before and after. So therefore, because of that, we know that it's creating an impact on the patient, on the child as well. And obviously, I think a very, very important thing is to end your discussion with limitation of the case. And I think even if it is a case report, I think it's important to talk about what you could have done, in just ask yourself what is missing or what you could have done better with the case. So talk about the limitations, and also say like what could be the future scope of your case report, how do you want to take it forward, or what can really what's the future of your case or your topic that you have taken. So this is about my discussion. And finally, I have my conclusion. So in my conclusion, I think in your conclusion, it's just important to think like what you want your reader to take away from your case. So what is just the key takeaways of your case? So I just write that early intervention and multidisciplinary approach is extremely important in CVI. And in my case, like how we gave very tailored and customized things to meet the specific needs of the child. We know the needs of the child. We made like a very specific plan for this particular child, and then we tried to come up with all these activities and everything that was very specific to the child, and then we trained the mother. So it was very customized to this particular child, which is what is required in CVI. And then finally I say that though we have a lack of evidence-based approaches such as this in early intervention, I think this case report is sort of like the start to more such things coming in, especially in India. So that's what I talk about, that further studies have to be done to address this particular gap. But then this case report is sort of like, it gives you an overview of how an early intervention can be done. So this is just my case report. So basically, I think what's important with your conclusion is it should be like simple. At the same time, I think it should be powerful, because this is something that the reader will remember when they close the paper. So I think that's really important. So now you have written your case report. Now, what after writing your case report? I think this is also extremely important. Number one is, I think, to take help. You won't believe the number of times I bugged my supervisor. I think Dr. Rizwana is here. So I think she remembers the case by heart. So I took like so much help from her, and also my other colleagues. So it's really important to like take help from people to write a good case report, and perform like multiple spelling and grammar checks. And also I think it's important to like avoid plagiarism and do like a plagiarism check before you submit your document. And another one important thing is to write your case report well. Like it should be a well written case report, because I think what I observed from the FAO reviewers point of view is they expect a well written case report. And obviously like do a final check of everything that you need to do. And I just want to specify that it's important that you follow the AAO, the guidelines which about the case report, which I've mentioned in the website once again, and then just do like a final check of what are the things that you need to do if you're leaving out something. So finally, I want to also say, how are they evaluated? And of course I said that it's evaluated by a subcommittee chair, but it's also necessary to know like it's also necessary to know how these case reports are evaluated. So obviously the complexity of the case report, that's why I said that it's necessary that you select a complex as well as an interesting case. And appropriate data collection is very important. That is, how many have you included all your visits? Is the case complete? Is the confidentiality taken care of if required? So all of these things really play an important role. Again, appropriate diagnosis. Have you covered the diagnosis from a pediatric case, like have you chosen the correct diagnosis for your particular case? Have you leaven out anything? So that's really important. And then like, is the treatment appropriate, and is the case, does it have a follow-up, and is it complete? So I think these are the important things that would be there, I mean, would be taken into consideration when the case is being evaluated. So these are just some of the articles which I read while I wrote my case report. So you can probably, if you're interested, go have a look at these articles. Apart from your AO guidelines, these can be really helpful, and you can these have really nice how to write a case report, and give you like a really nice idea of how you can enhance your case report. So I just want to say, like, this is a very special case report for me personally, because I used this case report in a number of occasions. I was able to get an award with this case report. Of course, I finished my FAO with this case report, and finally I published this case report. So obviously with the help of this amazing team. So from the start of this case report, my main goal was to publish the case report. And because this is was something that was really important. So you can probably, this is an IGO, you can just go and check out the case if you want to, and read it in like greater detail. So to all the FAO aspirants, and just to anyone who is interested in writing a case report, I just want to say that your final goal should be to publish your case report. I think that's really important. So focus your case reports towards publication, and make sure that it has that quality. And that's why you need to select something that you're motivated or you're passionate about, so that you can publish it. So I think that is from my side. I just want to thank, just remember SN and ESO at this point, because I think everything I am today, I owe to this amazing institutions, and also to this amazing person who is in the picture with me. I think she pushed all of us towards doing this fellowship and completing it. So, and also still is pushing us from behind. So thank you and for your patient listening. And I just want to say that please follow OCI and AAO India Chapter, because we have some amazing initiatives and amazing lectures and webinars coming on. And we have something similar or something interesting next month as well. So I think we'll see you next month. And if you have any questions about the case or about my presentation, I'll be happy to take the questions. Thank you.
Yeah, thanks, Janet. That was a very insightful, comprehensive, and structured presentation. And heartily congratulations for your publication of the same report. So you made several things clear to us. It very obvious from your presentation, the way you have presented, that you know how much you have invested your heart and soul into it, both in the management and as well as writing the case report. It is impressive. Yeah. So yes, case report is something, you know, that opens door for future research, and framing your article, structuring your article in the initial part, you have to invest a lot of time into it, so that it comes out to be unique and must contain some information, you know, so that people take the time and interest to read it, and also refer your article in their future studies. The main aspects of a case, you know, is how you approach the complexity of the disease, and how you have formed the protocol, and you know, check for improvement indicators over a period of time, and definitely is outcome matter. So that's what people are interested for, how your protocol, your management has improved the patient's life and everything. And at the end, you always give a future perspective of it, so that researcher can plan working on it in a large extent. And definitely the takeaway message and everything in the conclusion matters a lot. So yeah, that's a nice one. I can see the chat box for any questions at present. And
I just have a few comments to make so that
yeah.
you know, others. Excellent, Janet. Very, very impressed by the way you actually kind of sold the case to the FAO. I like that a lot. Rizwana is also here. Thanks, Rizwana. So this, I think, is such a nice way to put it forward. And to all the listeners and future listeners and the present FAOs, I'll say you have to get the diplomate next. So don't stop with the FAO, please, because we have so much content in terms of clinical experience that we have in India that I would really, push for people to get the diplomate. I know it's tough. I mean, there are arguments. There are people who say, "Oh, what would happen if I get a diplomate from AAO? You know, I'm staying in India." It's the entire experience. It teaches you so much. That is one, and the networking. Your networking really grows through those channels in terms of both the research, education, clinical skills, and reference to clinical cases. So I think the entire experience is really worth it to go through it. So the existing FAOs, I'll really push them to do the diplomate. And in India we don't have any dearth for clinical cases, so there's enough and more to do. And also I think there's some kind of a mind block as well. This I'm talking from both the FAA point of view, and also we are actually currently looking at applications for Dr. Rajeshri Mahadevan's case report award. So from both point of view, I just feel that it's not people only in institutions who have to do this, right? I mean, even people who are in practice, who see cases on a regular basis, clinical cases on a regular basis. And if you follow them up and if you have a proper medical record, I think everybody can attempt at this. It's not that, oh, you need to have, a huge setup, you need to be under an institution, only then you can do it and all of that. I don't think it goes that way. So you do get very good cases, even in private practices. And, if you're working under somebody in a private practice or anything. So it's just the way the case is presented, as Janet put it, follow-ups and the exact information. And I think one thing you said very, very apt, and I liked it so much, is be as truthful and as dedicated to the case as possible. I think that's the key. Because if the case doesn't, drive your interest, then there's no point in submitting it, I think. So those are the few things that I wanted to say.
I'd like to add, Janet, many congratulations on your FAAO, as well as publishing this case report. I mean, the end result is so much of hard work has gone into it, and the fruit of this is getting your case report published. The fact that, your passion led to this, you've driven that ideology that you have to be passionate about what you are doing. And at this point, I must congratulate Dr. Rizwana for mentoring you and the rest of the fellows of AAO as well. I'm sure all of you are really blessed to have such a person as your mentor and a driving force too. And Janet, what came across is the passion in the subject that you have. I mean, I would say that cerebral visual impairment is not a subject that I can really place my heart. I mean, I listen to a lot of lectures, though I can't really connect, but I was glued from the word go when you started presenting this case, and it made me, at the end of it, I felt, okay, it's something which is doable. Everybody can present a case. That kind of confidence that I got after listening to your case report, very structured manner in which you presented. I mean, it was a good learning experience, I would say. And people, like Lakshmi mentioned, people feel, what is an American fellowship going to help you based in India? It's not about that. It's about the journey that you're going to be taking up, good learning experience. I'm sure, like any cases that you take up in future, also you're going to be very methodical in kind of organizing the case And you're also driving in the fact that, report writing is not a joke. You have to be very methodical in, documenting this. So medical record keeping is going to be stressed at this point. And I think everybody should take it as practitioners, be serious, whether you are based in a big institute or a private practitioner. We need to have good medical records of each of our cases. So it gets very easy to present it anytime. And thank you so much. It was a pleasure listening to you, Janet, and many congratulations once again.
I would just like to, Jan, of course, it's quite, I don't know, I feel very gratified at this point, but they always say, right, it's not about the mentor. When the student is ready, then the mentor appears, basically. It's all in the student's hand. It's a receptiveness of the student. I should say that today I'm quite impressed by Janet first, but I worked with her for long. But I'm very impressed with Sauman as well, because the way Sauman moderated the session, apparently, Sauman, I should really tell you, man, like the way you brought out the nuances of what Janet did, moderation is an art. So what I realized is that this whole AAO India chapter, now that we've collaborated with OCI, I think is really blessed with all these young aspirational optometrists, vision science researchers and clinicians who have lots of talents. So it is quite gratifying at this point to see all these talents shining so bright. So I think it's a very happy day and a moment overall. And Sauman pitched in as a volunteer to moderate for Jan's session. So thanks, Sauman. And a couple of things when it comes to Janet is that the CVI, as Anita rightly said, CVI is not an area that everybody takes it up just for the complexity associated with it, because there are no quantitative tools to even sort of measure and document. So Jan did a lot of work in terms of, first of all, identifying the tools that are required to actually document the improvement. So all that she's put, like she did an enormous amount of research, even in understanding what clinical assessments to be done. What should I how should I document, so that it becomes very systematic and structured. See, for certain diseases, the protocol is established. Establishing a protocol and then evaluating the efficacy of that protocol and also implementing therapy, especially during challenging situations like COVID. So it all that I think helped her shine in her field. And she's doing a lot of work now on CVI. I mean, her blog post on CVI, the parent stories that she writes on CVI. I think there is a lot. And then now, of course, you know that she's a doctoral researcher at Rotterdam. I mean, so she's currently in Netherlands, came to Chennai for a short break, and she's now doing this presentation. So she really, like, in a very short time, she's specialized, she's excelled in this field. So I think if you can put your heart and soul into whatever area, even if it looks very challenging and complex, but if you put your heart and soul into it, definitely you can shine. And I think today is, again, it's another example. Like Manasi started it last, the first session. Again, she works on a niche area of, this whole pachychoroid spectrum and OCT and all that stuff. Now Janet and Sauman will again do his work soon, present his work soon. So overall, I mean, very, very aspiring young talents. Looks like the future of optometry in India is bright, Lakshmi ma'am. I think you should.
That's why I said next is diplomate, Janet. No stopping with FAAO, right? Next is diplomate. So I know it needs 2 years more, but
on diplomate separately, yeah. How to enroll and how to move forward with it.
That's your focus. I know it is very tough. It's a very tough road. But what I'm saying is, it's people might say, "Oh, what big deal?" But I'm just saying the entire experience of going through that, right, it teaches you a lot. Absolutely teaches you a lot. And if we have more and more diplomates like Rizwana, Vijay Kumari, and the others, then you guys will be actually doing all the interviews for the fellowship. So we need more Indians on the panel. Yeah.
Actually, very well said, ma'am, because that's the only way that we can see. It's not that we don't have the talent or the potential. It's all about the world, no? And I think we are on the right track. All these people are ambassadors for Indian optometry, the quality. And definitely another 3-4 years from now, these guys will be sitting in all the other committees.
Panels, yeah.
There is no doubt.
I need one person, one in binocular vision, one in contact lens, like that, one Indian in all those panels, right? Then that's the day. So thank you. Thanks, everybody.
Thank you so much.
Dan, you wanted to say something and I sort of like jumped in.
Yeah.
Oh no, ma'am, I just want to say thank you. Thank you. I think it's a great opportunity for all the new fellows. And as Lakshmi ma'am said, I think the next thing is diplomat.
Yeah,
Sure.
good, Dan. Somin, thanks a lot, man. Thanks for spending the time.
Thanks, ma'am. Thank you.
Thanks, everyone, and to the live audience today who joined us and making this event very successful. And the recording of this case report will be up on the OCI YouTube channel for all of you to access. Please do avail of this excellent case reports, and I'm eagerly looking forward to the next case report presentation from the OCI AAO India chapter, which is going to happen next month. You can look out for the announcement on our social media platforms of Optometry Council of India. We'll come up with a date, day, and time for the next case report. So here's all of us signing off from OCI as well as the AAO India chapter. Bye-bye.
Bye.